Okay, so good morning, good evening, good night, all of you. I'm DrChe, and today we will discuss some important reading tips for all of you. So, can you see my screen now? Leave Venus thrombosis here. Let me unmute because many of you are making. Okay, can you hear me? Okay, just we're online on Facebook also. Okay. Okay, so let us start. So anybody can just recap what we need to do in reading part A. Just recap what are the options and what is the strategy for reading part A. Anybody can recap and you can unmute yourself. Anybody can recap? No, skim and scan. And what else? Okay, nobody wants to participate. Okay. So you need to skim and scan very quickly. Okay, skim and scan very quickly and then read the questions and try to answer quickly. Okay. So in the skimming and scanning part, what we need to do quickly is just see the main headings, subheadings, the key points, okay, what is included in each paragraph, just quickly. Then you will get an idea about your text, okay, and then you can easily answer your questions, okay. So let us try this, okay, today. You can see the main heading is deep venous thrombosis. This is the main topic in text A. In text A, they are talking mainly about, please mute, please. Okay. In text A, they're mainly talking about what is deep venous thrombosis, which occurs when a blood clot, okay, in the body happens, will become damaged, okay. So while there are a number of risk factors, okay, two of the most common are this and that. A DVT can be serious, can have serious consequences. These are the consequences, okay? Then classification of DVT, it is acute here. And just if you see the next paragraph, chronic here. So we don't need to read them completely, what is in acute and what is in chronic, because we already know a little bit about what does mean by acute, what does mean by chronic, okay? Here is the timing, 2 week, 2 to 4 weeks. Here is 1 month, okay, and all of these things. Then we have risk factors. Text B is about risk factors, okay? Risk factors. If you want to go quickly through risk factors, anybody can tell me how you can quickly go through these risk factors. Anybody can tell me how you can go quickly through these risk factors? No? Okay, just let us, yeah. First is history of DVT, conditions or factors which make blood thin, okay, thicker. So here are the conditions, pills, and these things. You don't need to read them completely there, okay? Surgery, trauma, here is slow blood flow, Okay, here is surgery, pregnancy, here is cancer, venous catheter, old age, and obesity, overweight, smoking. This is just quick skimming and scanning. Okay, you don't need to read. Then we have the diagnosis. For patients presenting with symptoms of DVT, calculate a simplified Wells DVT score for the patient based on the following criteria. Okay, so these are criteria. Okay, so you have +1, and at the end we have -2. So all of these are simplified Wells score. If the score is less than 1, what to do? If the score is more than or equal to 2, what to do? Okay, all of these things. Okay, repeat ultrasound after 1 week, DVT exclude. Okay, all of these things. Anticoagulant treatment for DVT. So this is text C. In text D, a non-surgical treatment. Okay, non-surgical treatment of DVT. Here is written anticoagulants. You don't need to read all these things about anticoagulants. Okay. So, okay, because taking anticoagulants can cause bleeding problems if dose is high. The most common ones are these 10A inhibitors, heparin, and then we have warfarin. So now this is the strategy that you have done skimming and scanning. Anybody who is listening on Facebook, you can write something in the comments, okay? So I will answer your questions. If you have any questions, any queries, I will try to answer. I'm seeing your comments, okay? Only Miss or Dr. Rafi is giving the answers. Okay, so now today we will start from question number 15, okay? So we will do in the reverse order. So question number 15, which medication? So first we need to understand what is the question. Complete each of the sentence. This is not just in which text you can find the answer. You need to complete the answer with a word or short phrase. It can be one word or a short phrase with one of the text from one of the texts. Okay. Each answer may include words, numbers, or both. Okay, both. So question number 1 means question number 15. Which medications dose is based on some specific test instead of body weight? In which text you can find the answer? Uh, in reading part A, the main thing is time management. If you can manage your time, you can easily answer your questions. You can get B grade, okay? Okay, in which text you should find the answer? Guys on Facebook, please write your suggestions, okay? In text D, let us copy the question. Okay, so here is your text. You know the question. Try to find the answer here. Let me copy the question here. This is your question. Which medication dose is based on some specific test instead of body's weight? Try to find the answer here, please. Just let me know if the answer is here in these two paragraphs. If it is not in these two paragraphs, we will go to the next, okay? Here is your question. Try to find the answer here in these two paragraphs. Dr. Basit is with us on Facebook. Okay. So I think we should go for this specific part where they're discussing about the medication exactly. So here is your question, and you can find the question is here, and these are the medications. So please let me know how you will fill in this blank. Some of you are saying heparin, so it could be heparin also. So on Facebook, Miss or Dr. Jumi Sijo is saying heparin. Here people are saying warfarin, heparin. So I can say some of you are saying warfarin, some of you are saying heparin. So please try to give one answer. All of you should write your answers because this is the way to learn, okay? The best way to learn is participating. Okay. So warfarin. Wow, warfarin. Still, none of you have given the correct answer. All of you are wrong so far. So none of you is correct so far. You need to be a little bit specific. You need to read the text. You need to read the text. There are some small differences. Why 10A inhibitors? Why? Because I'm saying none of you is wrong. That is why. Please read the text. Try to match your keywords. Please. Don't give the answer quickly and without, thinking. On Facebook, anybody wants to answer on Facebook also? Can anybody talk with me? You can unmute. So those who have given the answer warfarin, could you please tell me why your answer is warfarin? Why your answer is warfarin? Those, because most of you have given the answer warfarin. So why your answer is warfarin? Those who have given the answer warfarin, please just let me know why you have given the answer warfarin. Anybody can give me the explanation, please? Why your answer is warfarin?
Hi, doctor.
No?
My name is Shreya.
Yes, yes,
Can you hear
doctor.
me?
How are you? Yes,
Hi,
please.
how are you?
Fine, thank
Actually,
you.
on the basis of the script, so heparin is it is written as dosing is based on body weight. So heparin is not the answer.
Heparin is
Warfarin.
not the answer. Okay. Mhm.
So, but in the second line is mentioned, unlike for standard heparin, where doses are frequently changed because of clotting times. But they are asking about the specific test instead of body weight. So that's why I mentioned earlier warfarin.
Mhm. So your answer is
Mm,
warfarin.
yeah, but a standard heparin is also making sense to me.
So where
But
you will go? Warfarin or standard heparin?
standard heparin.
Why not warfarin? Because many of you have given the answer warfarin. Just I want to
For
know why you
warfarin,
people have given the answer warfarin.
because the script doesn't match with the warfarin either.
Yeah, I know that, but why most of you have given this answer warfarin? You can see in the chat, most of you
Yeah, I'm one of
have
them.
given the answer.
Initially,
Yeah,
I was one
warfarin.
of them, but then I
Yeah,
changed my answer.
yeah. Okay, so let us read here. Heparin or low molecular weight heparin usually is usually followed by 3 to 6 months of warfarin, which is taken orally. Nothing is mentioned about what we are looking for. Okay,
Mm-hmm.
start working. Warfarin takes at least 6 and 4 or 5 days. Okay, nothing. For this reason, heparin and warfarin are given at the start of the treatment. Protects the patient, keeping in her blood anticoagulants until the warfarin kicks in. Warfarin is less commonly used since adverse. Okay, it requires blood monitoring, while say, does not. Warfarin is less commonly used. Okay, warfarin is less commonly used since the advent of 10A inhibitors because it requires frequent blood monitoring, while inhibitors don't. Okay, they don't need
Mm-hmm.
this. Okay,
Mm-hmm.
which medications dose is based on specific test instead of body weight. Okay,
Mm-hmm.
okay. So warfarin requires what it is written here, frequent blood monitoring. Okay,
Mm-hmm. Mm-hmm.
and if we go here in 10A inhibitors, they're easy to administer, do not require blood monitoring, so they don't need to be adjusted. So this is
Mm-hmm.
not the answer. So
Yeah,
this is totally wrong. Okay, now we have two
10
options.
inhibitor is not the
Yeah,
answer. Yeah.
so is given intravenously IV, while this one low molecular weight is given subcutaneously under skin. Low molecular weight heparin has short life and is limited from the body in 12 hours. Dosing is based on body weight. Okay, this is for
Mm-hmm.
low molecular weight.
Heparin,
For
low
for
molecular.
most adults, each dose is the same. Unlike for standard heparin, where doses are frequently changed based on clotting times. Okay, so what you have given answer warfarin. It could be okay. Warfarin is commonly used since advent of is less commonly used since the advent of 10 inhibitors because it requires frequent blood monitoring, while it is mentioned it requires frequent blood monitoring. Okay,
Yes.
is anything mentioned that we need to change the dose? Medication dose is based on some specific test
No.
instead of body weight. So one other thing is that I am mentioning that instead of body, unlike something else. Okay, so
Mm-hmm.
here it is mentioned body weight here. This is one
Mm-hmm.
keyword.
Mm-hmm.
Other keyword is change in dose. Even overall, it could be similar thing because if it needs frequent blood monitoring, it means we need to change the dose according to the blood monitoring. Okay,
Mm-hmm.
if the
Mm-hmm.
values are giving up or down. But this is a reading test. This is not medical knowledge test. Okay, this is
True.
just reading. What you need to match the keywords. Okay, so our keywords are matching here in the standard heparin. Unlike for standard heparin, where is
Mm-hmm.
referring back to what? Low molecular weight heparin or standard heparin? This where.
Standard heparin.
This where is referring back to standard heparin. So standard heparin doses, where doses are frequently changed based on clotting times. Okay, so I will go for standard heparin. This is the most appropriate.
Mm-hmm.
Some of you can say that warfarin requires frequent blood monitoring, but the all other keywords are not mentioned there. The best
Yeah,
match is standard heparin.
standard heparin. And the one thing
Yeah,
is
not
specific
only
test.
heparin, is specifically standard heparin, not low molecular weight heparin, because
Standard
low
heparin.
molecular weight heparin dose is based on body weight. So there are two types of heparin. Only answering heparin is wrong also,
Mm-hmm.
because there are two types of heparin. One is based on body weight, another is based on clotting times. Dose is based on that. So our answer is standard heparin, not warfarin, not low molecular weight heparin, not 10A inhibitors. Okay, so please be careful. These are small things, but these are the things that make you pass or fail. Okay. Okay. So now let us move to question number 16. Actually, the purpose of this class is not to teach you a lot of samples in a short time. The purpose of this class is just to teach all of you, because reading is the one of the difficult modules in OET exam. So the purpose of this class is to teach you that you can prepare yourself when you're doing reading tests, when you're doing practice. So you can work on those samples like this, okay? Doing critical analysis, why it is wrong, why it is correct, so why other option is not, okay? So this is the critical analysis that will help you to pass the reading module, okay? So next question is, it is considered as a risk factor if a patient has a sign of dash only only on the affected side of a limb, okay? So first of all, you need to find in which text it is possible to find the answer. Guys on Facebook, please write in which text you can find the answer to this question. It is considered as a risk factor if a patient has a sign of dash only on the affected side of the limb. In which text? Please try to answer, try to participate actively. No? Okay. So the answer you people are saying in text B. So this is your text B, okay? And this is your question. Sorry. So please try to find the answer and fill in the blank. So this is the question, and these are the risk factors. Okay, try to find the answer and write in the chat what is your answer,
It
please.
is the risk factor if a patient has a sign of only on the affected side of the
Please,
limb.
really don't no need to mention it. Just write in the chat. So once I invite one of you, you can participate definitely. Okay. So let other people think.
It is
Let them,
considered as a
yeah,
factor
let
if
them try to answer. You can write your answer in the chat, and then we will discuss, please. You need to find the answer quickly, please, because you will not have more than 1 minute. You only have 40 seconds, 50 seconds to answer one question in the real exam. Broken bone. Okay, guys on Facebook, what is your answer? Broken bone, DVT, injury. Okay, I have written these samples for a long time ago. At the start of this year, in January, February, and March, I think so. So it's a bit long time ago, and I didn't prepare before class that I should know this, and I should give you answers. Okay, so all of you are saying broken bone. Okay, most of you, not all of you. Okay, DVT. A history of DVT. So we have two answers so far, DVT and broken bone. Okay, a history of DVT. This is one. And here is injury to a deep vein from surgery, a broken bone, or other trauma. Know your keywords. Just look at the keywords. Your keywords are, it is considered a risk factor if a patient has a sign of dash only on the affected side of a limb. Is it mentioned something here in the broken bone in the DVT that this is only on the affected side of the limb? Is it mentioned anywhere? This part, is it mentioned anywhere that this broken bone is only on the affected side? If your broken bone is on the opposite side, then it is not a risk factor. So your keywords are not matching anywhere in this text. I think so. If I cannot find anything similar in the rest of the text, then I can go for what you are saying, DVT or broken bone. I can think anything about that injury. Okay. Injury, where is injury? In which bullet point? I think it is better for us. Lack of movement is in the same is lack of movement of the leg, one leg. Please try to understand is only the word only on the affected side of a limb. So lack of movement can be anything, anywhere. I mean a whole body, lack of movement of whole body. Okay. So I think we should go for any other text. Okay. Third, 1, 2, 3. Injury to a deep vein from surgery, a broken bone, or other trauma. But it is not written only on the affected side of limb. Let us let us we can think about these things if we cannot find any good answer in another parts of the text. Okay, so let us go to text A. Okay, deep venous clot. Okay, this I think you can find the answer here in this part. So please try to find the answer and give me your answer in the chat. Don't write something. Don't tell me anything. Lack of movement, injury, broken bone, DVT, none of them is the answer. Try to find the answer in this part that is in front of you on the screen and write in the chat. Please don't talk anything. Just write in the chat. Beating edema. Swollen. No, no, no. Let me copy the question here again so that you are not disoriented in time and space. So please read the question, read the text, try to find the answer. DVT is wrong, pain is wrong, swollen is wrong, petechic edema is wrong, lack of movement is wrong, injury is wrong, broken bone is wrong. Okay, just let me tell you one thing. Your answer is just in this part, okay? That is in front of you. You don't need to go here and there. Okay. Your answer is in this part that is in front of you on my screen, okay? Immobilization is wrong. Swelling is wrong. Swollen is wrong. Paresis is wrong. Pitting edema is wrong. Okay. So any nurse who wants to participate? Who is Miss Beena or Dr. Beena? If you want to participate, pain and palpation is wrong. Paresis is wrong. Any nurse who wants to participate? Any nurse? Any nurse, please unmute yourself, unmute and participate. Unmute and participate. Any nurse wants to participate? No?
Is it non-varicose?
Yes, please. Yes, what is your
Is it
answer?
is it non-varicose?
Yes, this is the answer. So out of these answers that are here, okay? So first of all, nothing is written about which leg here, the risk factors. Symptoms of DVT, this is not written about which leg. Patients had previously objectively diagnosed DVT. Is not mentioned in which leg. Immobilized for more than 3 consecutive days, had surgery within previous 4 weeks. It is not mentioned which leg. So first 3 options are not here, okay? Paralysis are recent cast emulation of lower extremities. What does this mean? Okay, sorry, I got busy without informing us. Okay, you. Okay, so we were discussing PTK things because okay. So now let us see here paralysis, paresis, and recent cast immobilization of lower extremities. Can anybody tell me if it is mentioned in one leg or both legs, or in which affected leg? Anyone?
Both legs.
Both legs.
Okay, in lower extremity, it can be in both legs. Okay, then we
Oh,
have swollen unilateral superficial veins, non-varicose ones in symptomatic leg. What does symptomatic leg mean?
problematic leg.
The
Affected.
problematic,
leg.
okay, affected leg, the leg which have DVT symptoms, okay, affected side
Yeah.
of a limb, okay, only on the affected side of limb. So this is one option. Let us go next. Malignancy with palliative care or treatment within next 6 months. It is not mentioned about which one. Petechic edema greater in symptomatic leg, okay. So again, we have word symptomatic leg here, and here we have alternative diagnosis, most likely then DVT. It is not clearly. So we have two options. Symptomatic leg is written here in point number 4, and symptomatic leg is written here in the second last one. Okay. So out of these two, which one is better option? Because this one, petechic edema, greater in symptomatic leg. It means it is in both legs. In one, it is, and the affected one is a little bit more than the non-affected one, but overall, it is in both. So out of these two, I will go for this because it is only or mainly in the symptomatic leg. Petechic edema is in both of them. Greater in symptomatic leg means both legs have edema, and one leg has less edema, one leg has big edema, greater edema, the symptomatic one, but both of them have. So that is why the better and the best, single best option is swollen unilateral superficial veins. Okay, you can write like this: swollen unilateral superficial veins. Okay, there would be 4 words. You can write in bracket non-varicose. You can write non-varicose veins, but better is swollen unilateral superficial veins. Anybody has any doubt so far? Anybody has any doubt? Any question? No?
No, sir.
Okay. So this was interesting question or not?
Yes, sir.
It was very interesting because most of you will be searching in the risk factors in the text B. So, and even if you don't find the answer, you will try to answer something like broken bone, something, what was the other option? That you have given broken bone and DVT. So this is not mentioned in the affected side, okay? So please be careful about these small things. The answer is not always uh, quickly quick to find, okay? You need to be a little bit. If you skim and scan at the start, carefully, and then it is easy for you to answer the questions, okay? Not all the questions, please mute. Not all the questions are tricky like this. Some of the questions are very straightforward, so you don't need to over become pessimistic, okay? Okay. So now the question number 17, which medication should be given to a patient with deep venous thrombosis in first 3 days to remove the blood clot, okay? In which text you can find the answer? Now it is very easy to know in which text you can find the answer. In which text? Guys on Facebook, please write your answers. In which text you can find the answer? D? Yeah, it is D. Now go to text D. First tell me you can find the answer in these two paragraphs or not, then I will show you rest of the part, okay? Can you find the answers here in these two paragraphs? No? Okay. So then, so here is your question. And here are your three medication or, possible options. Try to find the answer and write in the chat what is your answer, please. So guys on Facebook, okay, doctors and nurses. So far, all of you are wrong. So far, all of you are wrong. Okay, so please try to find the correct answer. So far, all of you are wrong. So what is the answer? What is the answer, please? So why you people have changed your answer now? Can anybody tell me? Still, there are some wrong answers. Anybody wants to participate? 10A inhibitors, XA inhibitors, it is not mentioned they are given in the first 3 days or not. It is totally wrong to give the answer 10 inhibitors, okay? Heparin is wrong. Warfarin is wrong. Heparin or low molecular weight heparin is wrong. So what is the correct answer? It is very easy. Warfarin takes at least 36 hours to start working, and from 4 to 5 days to reach its maximum effectiveness. For this reason, due to this reason, both warfarin and heparin and warfarin are given as the start of treatment. The heparin protects patient, keeping his or her blood anticoagulant until the warfarin kicks in. Okay, so here is your answer in this part. So what is the answer finally? Dr. Nadeem? Yeah, the answer is both. Medication does not mean singular. Medication you can use as singular, medication you can use as plural, okay? Which medication? It does not mean a singular medication. Medication can be used as singular, medication can be used as plural, okay? Which medication? Okay. So as warfarin takes some time to show the effect, that is why both warfarin and heparin are given at the start of treatment, okay? Heparin protects the patient until the warfarin kicks in, okay? So what is the answer? What is the answer? Both heparin and warfarin. So please be careful. These are small things, but they make a lot of difference. They will make you pass or fail, okay? I'm not saying you will get all the question tricky like this, but this is the practice that we are doing so that we can prepare ourselves for the real exam. Some question will be straightforward, okay? To an ambulating patient who is suspected to have deep venous thrombosis on ultrasound, dash might be given. In which text you can find this answer? In C? Okay. Let us go to C. Do you want me to? Okay, I can copy the question in the comments. Okay, you can see the question in the comments of Zoom. To an ambulating patient who is suspected to have deep venous thrombosis on ultrasound, dash must be given. So what is the answer? Anybody can discuss with me? So anticoagulation is not the answer. You should answer according to the text, okay? You cannot use your own knowledge. D-dimer is the test. D-dimer is not treatment. Anticoagulation is not the answer. Just match your keywords. Your keywords are matching here. This is ultrasound. It is positive. This is ultrasound. It is positive. This is ultrasound. It is positive. So all positive ultrasound, this one, and this one, all positive ultrasounds are coming here on this box. If you read this box, anticoagulation treatment for DVT, if a patient is ambulatory, consider treating as an outpatient with DOACS if appropriate, okay? So you can say just a little bit about must and these things, but overall, this is ultrasound positive for deep venous thrombosis, and patient is ambulatory. So you should treat as outpatient with DOACS, okay? So the answer is DOACS. You don't need to know what is DOCAS, okay? Just write DOACS, okay? You don't need to know about them, okay? This is not knowledge, medical knowledge exam, okay? To an ambulating patient who is ambulating, okay? Who is suspected to have DVT on ultrasound, okay? Dash might be given. I am not saying must be given. It is might be given. Might be given. It means if appropriate. If appropriate, give DOACS, okay? So the answer is DOACS, might be given. So in that case, DOACS might be given, okay? If appropriate mean might be given. If the patient is ambulatory and ultrasound is positive for anticoagulation, mean DVT, okay? So then you should give DOACS. This is the appropriate answer. What is considered as risk factor for developing deep venous thrombosis? In which text you can find this answer? Dr. Nadeem, the previous question's answer was both heparin and warfarin. Dr. Nadeem, okay. The answer was here. For this reason, both heparin and warfarin given at the start of treatment, okay? Because warfarin takes 36 hours to start working. That is why we give heparin and warfarin, okay, both of them. So no, our answer is question is about risk factors. So this is your question. What is your answer? What is your answer? Please mute. What is your answer? 6 weeks after birth is the risk factor.
11, 12.
Please mute, please mute, please. Okay. Older than 60? 6 weeks after birth? Older age? Any age? Here is the other option also. Any age can occur at any age. First 6 weeks after birth. I can see your comments on Facebook also. Miss Dr. Suraya or Miss Suraya and Dr. Yolanda Gonzalez de Moya. Okay, I can see your comments. Okay, so answer here is very easy. I am asking exact what age, not in general, okay? Don't write older age. Okay, older age is not exact age. Don't write any age. So risk factor is more than 60. Okay, you should write more than 60. It's a very easy question. Okay, more than 60 is your answer. Yeah, more than 60, older than 60, more than 60. Okay, older than 60, more than 60, being older than 60, whatever you want to write, you can write. This would be your answer. Okay, last question. Surgery and dash are considered as the leading risk factors for deep venous thrombosis. In which text you can find the answer? In which text you can find the answer? B. Okay, very good. So let us go to risk factors. Very good. So here are your risk factors and here is your question. Please try to find the answer. Write in the chat, please. Those who are watching us on Facebook, you can write your answers in the chat. Okay, I got first answer, that is broken bone on Facebook. And here I can see Dr. Israr Ahmad, slow blood flow in vein. Okay, surgery and dash are considered as the leading risk factors for deep venous thrombosis. Okay. Okay, on Facebook, you can give answer in the chat. Okay, very easy. Okay, good. So the answer is written here. Two of the most common are, while there are a number of risk factors for developing a DVT, two of the most common are injury to lower body and surgery. Okay, so I have written already surgery and you have to write injury to lower body. I consider leading risk factors. Leading factor, two of the most common. This is the paraphrasing of this synonyms of this part. Two of the most common, okay? Leading factors, two of the most common of these, okay? So this is the answer. So answer is not here in the risk factor. This was the main thing in this question that you have to answer, okay? So thank you all of you. I think you have learned a lot of things at the end. Just give me 1 minute. So we have our VIP hybrid writing course. This is very helpful. This would be very helpful for you if you are taking your exam very soon. So VIP hybrid course in which all letters will be marked by myself. So you will have daily lectures for plus 14 letter corrections, 3 referral letters, 3 urgent referral, 3 discharge letters, and 2 letters you will be writing to non-medical professionals. 1 letter would be to a pediatric patient. In 1 letter, you will have 2 patients. In 1 letter would be GP to GP transfer. In case of nurses, it would be 1 community nurse to another community nurse. Okay. Course fee is 100 British pound. After 30% discount, you can pay only 70. And most of the cases, I keep helping my students after they take the course and after they complete 14 letters. I keep helping them without any extra charges in most of the cases if I'm available and if I'm free. So if any of you is interested, you can join this course. Okay. One thing is some of you are mostly, uh, busy and sometimes you cannot join the class, you cannot send the letter. So one of the benefits of this course is even if you cannot join the live class, you will still get feedback on your letters if you're busy on your duties and these things. So still it would be very helpful for you. So if any of you is interested, any doctor, any nurse, you can contact me. Okay. You have my WhatsApp number. So thank you so much. I hope I will be writing one new case notes. I will share with you in 1 or 2 days, and then you will be writing that letter. We will discuss that letter, and I will give you feedback also in the next free class. I hope so. Okay, if I get time to write new case notes. So thank you so much, all of you. Thank you.